So about 5 years ago, Jim Cato asked me to join European Urology as statistical editor, and I said, fine, but as long as we can change things up. Let's really take the issue of statistics in urology publishing seriously. And the obvious point, of course, is that journal publishing is all about data, and we have to make sure that the data are appropriately analysed. And so we put a number of interesting initiatives in place. One is that we felt that any paper with substantive statistical analysis should be reviewed by a professional statistician. And the other idea that we had was to write some guidelines, and these would have two purposes. One, it meant that authors submitting to the journal could see what we would expect from a statistical analysis, and also meant that the statistical reviewers would have a sort of checklist of things to look for to make sure that the quality of the statistical reporting in papers submitted to European Urology was adequate. And so we did that for several years. It was extremely successful, and some of the other journals got interested in that approach. So I'm very pleased to say that we recently published an update of that original guidelines paper in the top 4 journals, so European Urology, BJUI, the journal Urology, and then the Journal of Urology. We had all of the statisticians involved in those 4 journals. I think it was a total of 15 to 20 authors, and all of us agreed on a set of reporting guidelines so that all authors submitting papers to those 4 journals will be expected to follow those guidelines.